If you're a trans woman or non-binary and you have sperm, you may want to consider freezing your sperm before you start hormone treatment. It's a very important step to take, and you might regret it if you don't get that chance later in life when you want to have children. It's a really simple process, and we're very experienced here at the Agora at looking after you. The first step will be to have a consultation and to have a sperm test done so that we know if you've got a reasonable number of sperm in the sample, and to advise you on how that sample could be used in the future. Once that's done, we'll obviously arrange for you to have some blood tests to ensure that we've screened you for sexual health, and that would include obviously HIV, hepatitis B and C, as well as gonorrhea, syphilis, chlamydia, and a couple of other tests which ensure that when you come to use the sample in the future, you can use it in all the different scenarios. We know that it can be a bit daunting to come and produce a sample at a fertility clinic, and we have all sorts of ways of supporting you with that. We do have a private room here, but we can allow you to produce a sample at home if you live near enough to one of our clinics. Once the sample has been assessed as being suitable to freeze, we will arrange for you to have a number of appointments, 2 or 3, where you come in having abstained from ejaculation, ideally for around 3 days. It gives us a very representative sample, and each sample, once it's frozen, if it's normal, could be used for several treatments. Samples are frozen in liquid nitrogen, and they're kept very secure in our cryo storeroom. 3 months after you have frozen you have come in to produce a sample for freezing your last sample, we will get you to come back and have a repeat sexual health screen blood test. You can, of course, start your hormones as soon as you've come in and produced your last sample. The blood test is purely to allow the sample to be scored as very safe to use, because there's been no evidence of any infection whilst you were producing the samples. And that means in the future, if you want to come back and use your sperm, you'll be able to use your sperm in all sorts of different scenarios. If you're having a relationship with somebody with eggs and a uterus, it could be used to inseminate, or you could, if you were in a relationship with somebody else who had sperm, you could use that sample or those samples in a surrogacy arrangement. So that's why we're very particular about making sure all the right screening steps are done.